A pneumonia outbreak is affecting children in Ohio. The Warren County Health District reports 145 cases of so-called white lung pneumonia in children between the ages of 3 and 14. So far, no cases are reported here in Northeast Ohio, and no evidence is linking this pneumonia and these cases in Ohio to the outbreak over in China. Pediatric infectious disease specialist with Akron Children's, Dr. Eric Robinette, is here now to tell us if families here locally should be concerned and how you can keep your kids safe this entire respiratory virus season. Thank you so much for being here, doctor.
Yeah, my pleasure.
Yeah, I think a lot of us are curious what's really going on and if these could be linked. So far, the evidence says no, but what is white lung pneumonia? And what are some of the symptoms?
Well, so white lung pneumonia refers to the chest x-ray finding, what the chest x-ray looks like, but really it's just a more severe type of pneumonia. So, like many illnesses, pneumonia can exist on a spectrum. Pneumonia fundamentally is just an infection of the lungs. It could be from a virus, it can be from a bacteria, and a white lung pneumonia would just be a more severe type of pneumonia.
Now, I mentioned the Warren County, Ohio, down near Cincinnati. They have 145 cases. So far, you're not seeing that up in this region, right?
We've not. We've seen the occasional sporadic case of pneumonia, which is pretty normal for this time of year. They've been a mixture of different causes of the pneumonia. But we haven't seen any large or local outbreaks.
Now, is Akron Children's preparing for this outbreak to potentially spread this direction, or how are you making any precautions?
Well, I think, in pediatrics, respiratory infections are our biggest, the biggest reason that children are hospitalized, and in the winter is the time of year that we see the highest rates. And so I think, we're definitely prepared to take care of a surge in respiratory viral infections because that's basically what we do most years.
Should parents be concerned about this or what's happening over in China? What would you tell families right now that are watching the news saying, uh-oh, what's this about?
Well, I think, first of all, given the history of the pandemic that's just passed and how terrible that was for society, I think it's sort of understandable that people would be on higher alert. Particularly with the pattern of there being, some what sound like concerning cases reported out of China. I think that it seems like right now what the evidence indicates is that this is a combination of a lot of respiratory viruses and maybe some bacteria in certain places. Like there's been some thought that in Warren County that it's mycoplasma, which is a bacteria.
How do you keep your kids safe from pneumonia or really any upper respiratory infection? Because this is the season, it is starting to go around.
Yeah, if we look at our data, we're seeing high rates of RSV, relatively high rates of COVID, and just as recently a pretty significant increase in our rates of influenza. And those are the viruses that tend to trigger the most pneumonias. There's a few strategies that you can use. To a certain extent, respiratory infections are unavoidable, but there's some things that people can do to lower their risk of having severe infections. So number one is making sure that your kids are up to date on all their vaccinations. There's several vaccines that are included in the regular childhood immunization series that protect against certain types of pneumonia. And then also immunizations against flu and COVID are both available, which are two of the more common viral triggers of pneumonia. And then for newborn babies and pregnant mothers, there's two different products that are new. The one for pregnant moms is a vaccine, and the one for babies is an antibody-based treatment that is designed to prevent severe RSV infection in newborns, and so far looks to be pretty effective. So that's an option for protecting those high-risk children from RSV as well.
Yes, and I'm wiping every surface with every wipe I've got, every doorknob, every light switch. We got to do it this time of year. Doctor, really appreciate your time from Akron Children's Hospital. Dr. Eric Robinette, thank you so much for joining us.
Yeah, my pleasure. Thanks.